remember Nancy Pelosi's health care promise? Try it and you'll like it. Well, today we're getting a new survey showing President Obama's health care law is expected to jack up costs for the nation's largest companies by nearly 9%. With the threat that those costs could be passed on to the rest of us, the workers out there, will health care become an issue again in the midterms? Let's bring in Deneen Borelli, senior fellow Project 21 and Fox News contributor, and Steve Murphy, Democratic strategist.
Thank you, Shannon.
Be here.
All right, Deneen, not a good report today. What do the Democrats do with those numbers?
Okay, well, it's not surprising that employers are concerned about rising costs, and they're concerned about the uncertainty that this legislation is going to implement. And you have to remember that this doesn't even take effect until 2014. So they're concerned now, and they're concerned about the future. And it's also not surprising that employers are reluctant to hire. We're faced with 10% unemployment, and this uncertainty is not good for our country.
Well, Steve, I want to ask you because Nancy Pelosi, when she was asked months ago about all the controversy about health care, said it's going to be settled by the time of the midterm elections. The issue is going to be jobs, and we're going to win on that issue. But now that doesn't look good either. I mean, can they win with both of these issues with so much controversy floating around out there?
Well, actually, the question is the health care issue as potent as it was when it was being debated in the spring? And the answer is no. I'm seeing in polls constantly for all the candidates that we're working for that the percentage of voters who say it's a top issue has dropped down to under 20%, and it was right up there with the economy in the low 40s. And part of this is the debate is over, but part of it is that benefits already are being felt by people. You have the young adult provision, you have the tax credit for small businesses who provide health insurance to their employees. You have the lifetime benefits and the donut hole being closed under Medicare. Of course, there are going to be additional costs to some businesses for this health care law because we got a quarter of the workforce who's not being covered.
Steve, there are over $500 billion
when that's changed, businesses are going to have to pay more.
Legislation, over $500 billion and over $500 billion of cuts to Medicaid, and they're adding 16 million people to Medicaid itself. I mean, that's ridiculous. This debate is not over. This is a done deal.
And Steve, we can look to the states to see that it is not a done deal for a lot of people. We have 6 states that have either enacted or signed statutes. We have 3 other states where this ended up as a constitutional ballot question. We're talking about measures aimed at repealing or blocking a part of the health care reform. A number of other states have gotten things bubbling up through their legislature. I mean, people in Missouri and in Colorado have been to the polls.
If you're asking the question, asking a question here as opposed to debating me on this, whether the issue is as strong as it was, it is not. It has declined in intensity, and the intensity of the opposition has declined.
60% of Americans want this Obamacare repealed. 60%. That's huge.
All right.
That's not an accurate figure.
We're going to leave it right there. We'd love to have you back and pick up this debate. Not over as it bubbles out. We'll see if it does impact in the fall. Thank you both.
Thank you.